Ketamine, common trade name for that is Ketelar. It is a dissociative anesthetic and a sedative. The way it works, it antagonizes the NMDA receptors in the central nervous system, which then causes anesthesia and dissociation. And it can also stimulate sympathetic nervous system and cause bronchodilation. Whenever it stimulates that sympathetic nervous system, you can have a raised heart rate, raised blood pressure, all that good stuff. It's sympathomimetic. Pregnancy class, it is actually not classified at this time. Thought that was kind of odd. Indications for it: pain management, procedural sedation including RSI, and then excited delirium. Some contraindications would be severe hypertension. Because this has a sympathomimetic effect, it can cause hypertension to even worsen. Adverse reactions, something to watch for: hypertension, dysrhythmias, tachycardia. It can cause respiratory depression, depending on the dosage, really, and then decrease in mental status, depending on your dosage as well, usually with that. Big thing, whenever you're giving it for pain and stuff like that, it doesn't make the pain go away. People just don't seem to care about the pain. It's kind of interesting to see patients that are under the influence of it. Some interactions to keep in mind: potentiates opiates, barbiturates, and non-depolarizing paralytics. So that if you give that in conjunction with something like fentanyl, it can really be kind of the magic key that takes away all the pain. Dosage varies greatly depending on where you're at, anywhere from 0.1 milligram per kilogram up to 2 milligrams per kilogram. So it's a very wide dosage range. Same with the kids, adults or pediatrics, same dosing. It's just going to be protocol specific. Typically with your higher doses, you get sedation, and then your lower doses are used for analgesia and stuff like that. Starts working in less than 1 minute, peak effects in about 5 minutes, and it lasts in the body of 10 to 20 minutes, so that makes it a good drug for EMS. The short-acting drugs are always EMS friendly. Something to watch for: we talked about the lower dosage and high dosage, but high doses also increase the likelihood of emergence reactions, and whenever they are no longer under the influence, then as they come back around, they can become very agitated. And so if you're worried about that, you can give them a benzo as well to kind of prevent that emergence reaction from happening.